and welcome to College Health 101. My name is Susanna, and I'm here to talk to you today about student health services on the University of South Florida, Tampa campus. Student Health Services is a division of student affairs within the Wellness USF initiative. These departments are in part funded by tuition fees to provide health and wellness resources, such as counseling sessions, health education, and general medical appointments at no expense to our students. The Student Health Clinic is centrally located on the Tampa campus, just east of the USF bookstore. If you're taking the Bull Runner, you can stop at the Marshall Student Center. If you're driving, we do have parking available just behind our clinic. The clinic's general hours of operation are Monday through Friday, 8 a.m. to 5:30 p.m. Please visit our website, shs.usf.edu, for the most up-to-date information and hours, including extended evening hours and holiday closings. When the clinic is closed, you may call 813-974-2331 to speak with our after-hours advice nurse to discuss any medical concerns you may have. If the issue is not addressed, you may want to visit a nearby walk-in clinic. Of course, in the event of a life-threatening emergency, we urge you to dial 911 from the nearest telephone. Now, if you would like to schedule an appointment with one of our providers, please call 813-974-2331 during regular business hours to schedule an appointment with your preferred provider and preferred time. If your cell phone is handy, you may want to go ahead and program that number in now. That way you're ready in the event that any injury or illness should occur. Unfortunately, we cannot guarantee same-day appointments. However, here's a tip. If you do call early, the earlier the better, you have a greater likelihood of getting an appointment time at the time you prefer. Our clinical care team at Student Health Services is professionally staffed with credentialed, licensed physicians, nurse practitioners, and physician's assistants. Our clinical support team is staffed with licensed registered nurses, LPNs, and medical assistants. The staff have specialized areas of expertise and have the ability to address a wide range of issues, including concerns for the college-age population. All Student Health Services employees are HIPAA trained, so you can feel comfortable knowing that your concerns and your privacy is protected. What is said at Student Health stays at Student Health. That means if anyone wants access to your medical records, you have to ask for them yourself with written permission. Your mom and dad cannot access your medical records unless you choose to give them the information yourself. Student Health provides students with general medical services, the kind of services that you might find at an outpatient medical clinic. For example, we treat acute symptoms, chronic illness assessment, immunization, allergen shots, physical exams, and minor procedures. Those are just a few of the services that we provide. If your condition cannot be treated at Student Health Services, we will provide you with a referral to a specialist. For your convenience, there is a full-service, independently contracted lab on site for lab tests, should you need them. And there's also a pharmacy on campus at the Marshall Student Center if you need to have prescriptions filled, transfer prescriptions, or purchase any over-the-counter medications. In addition to our medical services, Student Health Services does provide nutrition counseling with a registered dietitian, as well as general health and wellness information, including STI prevention, sexual health education, and birth control options. A new resource we've recently added is our Student Health 101 newsletter. It's an interactive newsletter that can be accessed from our website, and it provides information and resources that are relevant and specific to student health. The health fee, which is included in the cost of your tuition, supports the medical and educational services of Student Health, the Counseling Center, and Wellness USF. Because you've already paid this health fee, you can come into Student Health Services for general medical office visits at no out-of-pocket expense. It allows you to also receive student rates at any specialized services, including women's health exams, which are much lower cost than the rates you would receive off campus. If you have insurance, you will not have to pay a copay for general medical office visits. Sometimes a general office visit will incur charges, such as if lab tests are needed or equipment like crutches or splints. In these cases, your visit will be billed to your insurance if you have insurance. You will be responsible for payment for any services not covered by insurance, and you can check out our rates and fees as they are located and posted on our website. You may also choose to self-pay yourself even if you have insurance. For example, if you're on mom and dad's insurance and you don't want them to know that you visited student health. In that case, just let us know when you come to the clinic. Any charges that you incur can be paid by credit or debit card, or we can transfer those fees to your OASIS account. If you have health insurance, please review your coverage so that you know what services are covered and what costs you may incur. Also, be sure to bring your insurance card with you when you come to campus. Student Health Services is a network with over 100 different plans. We ask that you please look at our website for a full list of our plans. Again, that is shs.usf.edu. If you have an HMO, please choose one of our physicians as your primary care physician. If you currently have TRICARE, we will need your military ID, and the first time that you're a patient at Student Health Services, we ask that you bring the information for your military sponsor. If you do not have health insurance, USF does contract to provide and offer an insurance plan to those students who want coverage. Our carrier features nationwide coverage and enhanced benefits at Student Health Services. Students can purchase this plan during open enrollment at the beginning of each semester. An annual plan and also semester plans are offered. We do recommend that you strongly consider carrying insurance because healthcare is so expensive and because the health fee is not insurance. It cannot assist you in emergency rooms. The health fee is not able to assist you when you're traveling or off campus or when you have no access to Student Health Services. If you have any questions, please contact the Student Health Services Insurance Office. All students are required to sign a medical history form to show immunization compliance with the state of Florida mandates. The form has to be turned in at the beginning of the semester by the 5th day of classes. You should have already received a copy of this form, and if you've already turned it in, great job. Now, if you haven't turned it in, you can find a copy on our website and download it. We ask that you turn this in promptly as possible, because until you have documented your immunizations and submitted it to us, you will have a registration hold, and you may have delays in your registration. You can bring the form in person to our office located in the Student Health Services Annex, lower level of the bookstore. And you can also fax the form, mail the form, or email the form to us. If you need any immunizations or titer lab tests done, they can be done for you at the Student Health Services Clinic. Student Health Services has been in the business of treating USF students for 50 years, and we welcome you to the Bowles family. I hope that I addressed some of the questions and concerns that you may have regarding healthcare at Student Health Services, and access here at USF. For more information, be sure to visit our website, shs.usf.edu. Thank you for your time, and go Bulls!